Hello.
Hi.
Hi, my name is Corey. I'm going to be your nurse today.
Okay.
Okay. Can I ask you your name and date of birth? Just look at your wristband.
Yeah, Jane Smith, January 22nd, 1978.
Perfect. Okay, I'm just going to wash my hands for 40 to 60 seconds to prevent the spread of infection, and I'm going to provide you with some privacy.
Thanks.
Okay, sure. So I'm going to do a limited assessment on you today. Is that okay?
Mm-hmm.
Okay. So first I want to take your temperature. I'm just going to place the temperature probe inside of your mouth. It's going to have a sheath on it, all the way under your tongue, all the way to the back. This is testing the oral temperature. It's the most effective and accurate temperature, and the normal rate is 98.6. The least effective would be auxiliary temperature, just under the armpit. Tends to be 0.5 to 1 degree lower at 97.6 degrees, and then you have the rectal, and you have the oral and the ear temperature, and those tend to be 0.5 to 1 degree above the oral temperature at 99.6 degrees. As I said, the oral is the most effective, and the auxiliary is the least effective. Then I would like to take your blood pressure. So at the blood pressure, I'm going to place the blood pressure cuff just here on your arm, 2 centimeters above the antecubital fossa, and I would place my stethoscope at the brachial pulse. This is the brachial pulse just here to take the blood pressure. I'm not going to take the blood pressure today, but a normal blood pressure in an adult is 120/80. Anything under 120/80. Anything from 120 to 139 systolic, and from 80 to 89 diastolic would be considered prehypertension. Anything from 90 to 99 diastolic, and 140 to 159 would be considered hypertension type stage 1. From anything above 160 and above 100 diastolic, 160 systolic and 100 diastolic would be stage 2 hypertension. And anything 180 systolic and 110 diastolic above that and above would be a hypertensive crisis. So that's our blood pressure. I'd also like to take your pulses. I'm going to show you the pulse sites on the body, and I'm going to take your pulse. So we have the carotid pulse, and you would take it on both sides. With all of the pulses you should take on both, you have the brachial, you have the radial. Go ahead and lay back, and I'm going to pull this out. Perfect. Flexing the knee, you have the popliteal. If you can just rotate your hip out, here you have the femoral. Just here at the bottom of the leg, you have the posterior tibialis, and on the top of the foot, you have the dorsalis pedis. All right, if you can just sit up again. Very good. I'm going to take your pulse now, your radial pulse. So just place my 2 fingers here on the radial pulse and take a reading of 30 seconds. And I'm counting the pulsations that I feel here, and the normal rate is between 60 and 100. Anything under 60 would be bradycardia, and anything over 100 we would call that tachycardia. Your pulse rate from taking it 30 seconds, doubling it into a minute, was 68 pulses per minute, and this is a normal finding for you. This is the pulse was regular, it was even, it was symmetric bilaterally. I would check both sides. It was a +2 amplitude, so we have a scale amplitude. It's a 0 to +4. Hers was +2. This is normal finding. This is what we expect. 0 is absent pulse. +1 is a weak, thready pulse. +2 is a normal, regular pulse. +3 is a increased pulse, and +4 would be bounding. As I was taking her pulse, I was also notating her respirations. And the respirations I got was 14, and this is a normal finding. Normal is 12 to 20. 12 under 12 would be bradypnea, and below and above 20 would be tachypnea. The respirations were regular, even, smooth, unlabored, no use of accessory muscles, symmetric bilaterally, chest movement. There's two types of respirations that are, there's several, but an example of two is wheezing and stridor. So wheezing is a high-pitched continuous breath sound, and it is caused by airway obstruction, as in asthma or foreign body obstruction. And another would be stridor, and stridor is a high-pitched crowing sound, and it can actually be heard without a stethoscope, and it is considered a upper airway obstruction emergency. Okay, so we did your pulse sites, your respirations, we did your blood pressure, your temperature. Let's do the Allen's test. Okay, so the Allen's test is used to test the patency of the ulnar and the radial arteries of the arm. So I would come and I would place both thumbs over and occlude the arteries, holding down, and I would ask you to open and close your hand. And as I release the ulnar artery, I'm going to ask you to open your hand. So open your hand, and the hand pinks up nicely. And this shows patency of the ulnar artery. And then we're going to do it again, and I'm going to occlude both and open and close. And I'm going to release the radial artery and open your hand, and it pinks up nicely. And this shows the patency of the radial artery. And that's our Allen's test. Additionally, I'm going to go ahead and grasp your hand. I'm going to take a look here at the epitrochlear node. The epitrochlear node is here between the bicep and the tricep, and you want this node to be non-palpable. A palpable epitrochlear and large epitrochlear node would indicate infection of the hand or the arm. So yours is non-palpable and expected finding. And additionally, you have the inguinal nodes. These are just here in the mid fold of the leg. Inguinal nodes should be non-palpable or slightly palpable and movable if they're enlarged more than 1 centimeter. Enlarged nodes indicate an infection, especially an infection of STI or UTI. We also have murmurs. Murmurs are an extra heart sound, and it's an abnormal finding. So if I were to hear a murmur, I would say that it would be a harsh blowing sound, and it is caused by a disruption of blood flow. And we would grade that on a scale of 1 to 6. So 1 would be a low, like a musical note sound, very low sound, and then you can grade it all the way up to 6. And 6 is a very harsh, loud sound, and it actually, when you're listening to it at the apex of the heart, you can hear it without even putting the stethoscope to the wall of the chest, which is another one of our pulse sites that we didn't talk about. So if you can just sit up a little bit, and then I'm going to show you mid-clavicular line, 5th intercostal space. I'm just going to touch you here, 5th intercostal space, and I would just place my stethoscope in this area and listen to the apical pulse. And I think this concludes our exam for today. Thank you.
Thank you.